and allow others to join us as they're available. I'd like to introduce myself. I'm Laurel Hanson, MACC's Program Manager, and I'm joined by my co-moderator, Clara Owen, MACC's Communications Director. Welcome and thank you for participating in this. This is MACC zooms in on program adaptation during COVID-19. This is the fourth in our series of Zoom sessions that bring members together during the COVID crisis. We listen to our members and convene them around the issues that matter the most to them. And we know this is one of those. Every organization has been tackling their own programming challenges, adapting, learning, and evolving during this crisis. And this is your opportunity to talk directly with other fellow network members about what you've tried, what's worked, what you've learned. Today's goal is to create space to exchange ideas and learn from each other's shared experiences. I'm very excited that we've all gotten together today. And on behalf of your MACC network, thank you for being here. Now, a few directions for participating. We're trying something new this week, so bear with us. You'll see the virtual agenda on the screen. We're going to do a series of breakouts during today's session. And we're starting with an opportunity to introduce yourself to a small group of members. And so as a warm-up, we're going to practice this. We're going to send you to a breakout room for just 5 minutes, and you're going to have the opportunity to meet a few other MACC members. So we'd like you to introduce yourself to each other by your name, title, and organization, the usual, but then share your response to an icebreaker question, which is this. What's one thing that your organization or team have done that you're proud of since this crisis started? Let me say it again, it's a really heartfelt question. What's one thing your organization or team have done that you're proud of since this crisis started? So we'll bring you back in 5 minutes, and then we'll get started on the programming discussion. So enjoy your introductions. All right, welcome back, everyone. Thanks for taking the time to do some introductions. I enjoyed hearing from the members in the room I was in. Zoom's great. Everyone's using it. So now we're going to segue into the breakout program discussions, sort of the meat of this gathering today. And the good news is you get to choose which room you get to go to. We've picked a few sort of topic discussion areas, and we have some questions for you to consider in your conversations. We're going to do two rounds of breakouts. We have time for that, I believe, within our hour together today. And let me introduce the topics. And again, you get to choose by making a note next to your name. So, all right. So the topics today, as you see, we're talking, we have 4 rooms. Room 1, we're talking about staffing adaptations. So adaptations to staffing your programs and services. Room number 2, we'll be talking about adaptations to your actual programming adaptations. Room 3, fundraising and advocacy adaptations, either or both. And then room 4 is a sort of a post-stay-at-home adaptation, so a discussion around that. So direction-wise, you're going to choose your room, and Clara, chime in if I'm not adequately providing directions here, but you're going to find yourself in the participant list. So if you see that toolbar at the bottom of Zoom, Manage Participants, you open that up, you should see a participant list. Not Clara, if I'm describing this correctly. You find yourself on the participant list and you click More, is that correct? Or you clicked Rename, is that correct, Clara? And
Yep, just hover over, put your cursor over your name and some options should pop up and one of them should say Rename. And then you can add the number to the end of your name.
Yeah. So you'll actually, when you go into rename yourself, you'll just put a 1, 2, 3, or a 4 in there. That will indicate, do you want to talk about room 1, 2, 3, or 4. And then Clara will know where to send, which room to send you to. So hopefully that makes sense. And we have the chat room available if you have any technical questions. Let's see if we, oh, there, we're seeing some people do it. Add your room number next to your name, and or you can certainly change your name as well. If by chance you're on the phone, I don't know if anybody is, it'll be difficult for you to be in a chat room, so you'll stick in the main room. So go ahead, find your name, choose your room. Once we send you to the room, you'll see discussion questions to address and share with your network. We'll have about 10 minutes for the first round. You will want to select somebody to sort of listen for themes and highlights, because we want to hear a little share back from each room. So we'll have 10 minutes in the room for discussion. How does it look in Clara? Is everyone ready?
We're pretty close. And just a note, so there'll be a MACC staff person in each room who's going to present a slide with some discussion questions. So MACC staff, go ahead and still pick your room, and I'll try and get you in the right room, but I might have to force put you in a different room depending on how things shake out. But still go ahead and choose which room you'd like to be in. And if there's one room that ends up being super popular, we'll create 2 sessions for that room. We'll shuffle our rooms around a little bit.
Yep. Same topics in round 2, so you can mix it up. And Claire, you can send me wherever you'd like. That went so fast. Was that 10 minutes? Wow. I feel like we just barely got started digging into discussion with everybody. It goes fast. Claire, is everyone back from rooms?
Everybody's back.
Awesome. Well, it's okay that we just got started with that discussion, and because we're going to do a second round. We had maybe a little technical difficulty on the first round, but it all worked out. Want to appreciate the time that you spent in that first round, and if you have somebody who can share, maybe just if you have a few key themes or highlights, I'd like to go around the 4 rooms, and we'll start with room number 1. And is there room number 1? We was talking about staffing adaptations, and can somebody from that group unmute yourself and maybe share a few highlights?
We actually did not have anyone go into that room, so we can start with room number 2.
Room number 2. I was in room number 2, so I know those folks. Anyone from group 2 want to add a couple of highlights?
I can talk a little bit more. I see a message here from Liz just wanting to chat more about our case management structure and working from home. So maybe I'll take that opportunity now if that's appropriate. So we also in room 2, people were talking about wanting to learn more of how programs have adapted. One way is that obviously working from home has become the new normal, and having to get all the equipment that we need. But as far as our case managers, we have them all working from home right now, and we were allowed to instead of doing face-to-face visits, our contracts got approval from DHS and CMS to be able to do those face-to-face visits that are required annually over the phone. So we've been doing that and using interpreters over the phone as necessary to complete those visits, and then also doing even more. And we already do a lot of work with our clients over the phone throughout the year, but doing more check-ins. So for example, all of our Medica case managers, they asked us to reach out to every single client that we serve to have a conversation, to check in how they're doing, and then also provide some extra mental health resources during this time. So that's how we've done some of the adaptations. Unfortunately, we're still pretty paper heavy, so people are having to go into the office weekly or every other week to change out charts. So I think what we need to do, if we wanted to have some more work from home options, which I see this as an opportunity that we've learned what works for work from home, is that we need to start working on having more electronic charting charts instead of so much paper charts.
Thank you, Paige. We heard some great things in group 2, and if you didn't get a chance to share, but you'd like to put it out there, the chat is open and available for you to add your comments as well. So we'd love to hear from you there. Should we move on to group 3? Group 3 is fundraising and advocacy adaptations. Anyone from group 3 like to share back?
I can jump in. Both PJ and Claudia shared about sort of the challenge of grant funding right now, and I think feeling, glad that many funders have shifted to general operating, but it feels like kind of shifting sand under everyone's feet. So Claudia and AJ both had grants, out there in process, site visits done, and then, funder takes a left turn to focus on COVID, and then also just trying to balance the, what the outcomes that were written up in the grant originally, they're going to change entirely. And so it feels like it's very much an area where the ground is definitely shifting under their feet. PJ shared about Better Futures sort of trying to adapt, creating an e-commerce model for part of their work. And so talked about that being something that would stay after the crisis. Has been kind of on their priority list for a while to move that, to build that online component to their business model. And so thought that was exciting to hear. Either of you two want to chime in?
One quick thing, and I'm mainly saying this because I am all ears, like email, chat, whatever, from people who also use special events to help raise funds, whether it's an annual or just a periodic. We're doing research, we're scrambling to try to figure out how to do that, because one of our only kind of reach to individuals is an October gala, and it's a very big deal. So, and we're not gonna be able to do that live, I don't think. So just trying to figure that out.
Yeah, I think there's a ton of work that's, everyone's trying to figure out what for events and special events and fundraising for sure. And PJ's comment as well, interesting about the e-commerce model. I have heard that our member Hope for Youth has been doing some e-commerce, so there might be some, in both of those areas, there might be some member connections that we can help foster. Yeah. Good. How about group 4? Group 4 talked about a post stay-at-home adaptation. Anyone like to share from group 4?
I can talk about group 4. I'm sorry, I was the first one who asked the question, and we only talked about my question. We are housed, our agency is housed in a building that has multiple businesses in it. And so the concern we have is we would like to put in place some moderate restrictions, such as can everyone wear a face mask as they come in the door? And could we have a disinfectant, kind of like a station? Can we take everybody's temperature? So, and what we don't have is the email addresses or the phone numbers of all the businesses. I only have their names, And the suggestion is that we get together and have a proposal presented to the landlord. But again, to get together with these individuals, it would take a bunch of time, but maybe that's what I need to do. And we would come together and then this proposal would go to the landlord for him to support us.
Interesting. There's a lot of things to consider as you want to start planning a recovery and a reentry. And sometimes you can't make those decisions individually because they involve people you may not even know that well, like a shared tenancy situation. Thanks, Mary, for sharing that. I know that there's probably a lot of conversation going around about that reentry and the adaptations that are going to be required. And I have a feeling we'll perhaps dig into that as a standalone session here in the not too distant future. So we want to do one more round. We want to do 10 minutes, and I think we'll be even smoother and quicker in this round as we've figured things out. So please pick a round 2 room. And I want to remind you, room 1, if you want to talk about staffing, room 2, programming, room 3, fundraising, advocacy, room 4, post stay-at-home adaptation. Go back up into your name and participants and put a number next to it, and Clara will send you to the room that you're interested in being in. And go to all 4 rooms. Is there anyone from any of the rooms that would just like to share a final comment before we start to close out this session? I want to encourage folks also. Oh, go ahead. Well, we had a rich conversation in group 4, and all of the sharing back that we have been able to gather will be including in an e-goodie bag, summary of the themes, and also working on, and you'll be getting that, and also working on what our next conversations and deeper dives can be. Again, I want to thank everyone for your inspirational and your approach to these challenges. This does bring us to the closing of today's Zoom conversation, but we'd really like you to consider, are there topics today that you'd like to have follow-up conversations with other network members? Anything that we didn't cover that you'd like to talk about or talk more about? We're committed to supporting our network and being relevant to your current needs. Certainly contact us afterwards at MACC or leave your comments in the chat. Watch for that after session email, that e-goodie bag that I mentioned, and make sure that you do share your feedback in the survey, because that will help us understand the learnings and what you heard today. So again, I want to thank everybody. We'll stay on this Zoom until 11. So you have time to add to the chat. Let us know what you think, what you would like. And I just want to, again, say thank you. This concludes our session. I want to wish you well. Best wishes to everyone. Thanks so much.